South Sudan is vulnerable to disease outbreaks. In 2019 and 2020, measles, a vaccine-preventable disease, caused outbreaks in at least 20 counties and 4 internally displaced people's camps. Early detection and rapid containment of major disease outbreaks such as measles, viral hemorrhagic fevers, cholera and malaria is crucial to help reduce needless illnesses and deaths.
Outbreaks, you need speed. We need to promptly identify cases so that it's treated. Not only that, but also to ensure that they don't infect other people.
For effective alert management at any time, a multidisciplinary rapid response teams are in place to reach desperate people in remote areas.
Rapid response teams, these are really important teams in terms of actually WHO supporting countries to respond to outbreaks. When there is a condition in whatever setting, maybe in a health facility or in a community that happens, of which the health workers think, I think this is abnormal. For example, you used to treat maybe 5 cases of watery diarrhea, right? And then in a week, instead of 5, you see there are 20 or 25. That raises an alarm. So this team of 7 people with the different expertise are really meant to go and investigate, to assess what is happening in the community, interview the community members, collect a sample, then take these samples to laboratories where they can actually test and confirm what is happening.
Although there has been progress registered in strengthening emergency preparedness and response in South Sudan, there has been a range of challenges. This evolves around the weak health system, poor access to all health facilities, delivering products for all priority diseases, among others.
It is important that all cases in the community are identified, because if they remain in the community, they will be source of transmission to other people.
In 2020, the rapid response teams identified, investigated and responded to over 7,000 alerts, including outbreaks of COVID-19, measles, malaria, among others, from multiple locations. The teams are providing timely and appropriate treatment to people who have had little or no access to healthcare services.
The RRTs themselves are, I think, an important one to alert. They are just supposed to be doing the firefighting mode, in which where you have an outbreak, they come and they alert, right? With hopefully engaging with the other international and national actors, of course, to scale up a response to an epidemic occurrence. But it can be also a displacement, for example, that could happen and overburdens the local health system. So, as Chris says, yes, I think it's an important component that spearheads some of our ambitions in the health system. Nonetheless, I think there's still a long way to go to really make that system more seamless and more sustainable as a part of South Sudanese healthcare system.
For South Sudan perspective, this is also linked to what we call the integrated disease surveillance and the response, where we have a tool which we have trained our healthcare workers, and actually on a weekly basis they can actually monitor different what we call disease alerts. And of course, when you really identify an outbreak quickly, you must mobilize a response to that, which may include, for example, health promotion, which may include mobilizing vaccination to the communities, and so forth and so forth. But also that may include case management. So it's important that this rapid response team are actually really mobilized, and really thanks to ECHO funding that has really helped us in terms of keeping this rapid response team viable.
Ensuring effective support for surveillance, outbreak investigation, coordinated multidisciplinary, multi-hazard approaches to disease prevention and control has been instrumental in identifying and responding to disease outbreaks and has helped to target interventions to prevent excess illnesses and death.
I would really call upon many partners to join hands with the WHO in terms of making resources available, financial and technical, to support the ministry, to build their capacities at national, at subnational level, build the capacities of NGOs that are operating down there, to make sure that when, for example, an alert comes or an outbreak, so you have really more people who are prepared, who are trained to really go and actually do the investigation.
There's a lot more that needs to happen to really say this is a success. I think there has to be still an increase in sustained engagement. And this is not only funding, but it's also commitment from those organizations that are mandated to provide the technical support, but also from the government to actually start taking ownership, financially as well, ownership of that system, if we want to see a truly sustainable, responsive, and resilient system of healthcare, understanding the huge amount of needs across South Sudan.
The multidisciplinary rapid response team works to ensure rapid, coordinated detection, investigation, and response to stop further spread and minimize the impact of emerging outbreaks or emergencies.
We need to constitute them, we have to train them, we have to equip them, and we have to make sure that they have means to reach to the isolated population. But we also identify some potential community health people who can be trained so that the continuity of these services can actually be more, can be accessed.
ECHO has been supporting Ministry of Health in implementing the integrated disease surveillance and response. And the rapid response team has been part of the integrated disease surveillance and response even before COVID started.
WHO has been providing technical assistance to reinforce knowledge and skills of the rapid response teams, timely deployment of the team to investigate alerts, mobilizing resources to support the rapid response activities in the country.